I'm technology reporter Nilesh Christopher reporting for the Economic Times, and we have an interview with a doctor who uses virtual reality to treat cancer.
Hi, I'm Dr. Pramod Chindar. I'm an orthopedic oncology surgeon in HCG. I treat bone cancers.
Dr. Pramod is probably one of the first few doctors who use virtual reality in the treatment of cancer. Let's talk to him.
Virtual reality is one thing what we use it mainly for the pain control in children who have undergone massive reconstructions in bone cancer. During the physiotherapy at home, when I discharge these patients home early so that they can take a good physio at home, this will give us a homely feeling at being at home.
Pramod has been using VR in the treatment of bone cancer for about 1.5 years, and he says that the pain endured by the patients has come down by about 40%.
This is a 3D reconstructed tumor model which will help me in deciphering where exactly the tumor is.
The occurrence of bone cancer is quite rare and costs anywhere between 5 and 25 lakhs to treat it, is what Dr. Pramod says.
This is one surgery where I am using a 3D printed bone model for the precise removal of the tumor, without which the long-term quality of life would be compromised. Or without 3D bone modeling, we could have gone for a radical resection of the bone, which has been avoided. Now we are doing a precise resection of the tumor.
The doctor is currently experimenting the use of VR in the treatment of stroke in addition to what he usually does, which is the treatment of cancer. Though tech like VR and 3D printing have a long way to go in terms of adoption, instances like these, though anecdotal, definitely act as a ray of hope for many. Well, folks, that's all from me for tonight. I'm Nilesh Christopher with the Economic Times. Stay tuned for more. I'll see you in the next one.